In this video, we'll be discussing about different insulin preparations. We have discussed in two previous videos. In the first video related to diabetes, we discussed about the drugs called as insulin secretagogues, which means those drugs which increase insulin secretion from the beta cells of pancreas. In second video, we discussed about the classification of anti-diabetic drugs used for the treatment of type 2 diabetes. In this video, we'll be discussing about insulin preparations. Insulin is a hormone, it's a peptide hormone, which is secreted by beta cells of pancreas. Now, insulin is used in type 1 diabetes also, it is used in type 2 diabetes also. Now, in type 1 diabetes, insulin is the drug of choice. Why? Because type 1 diabetes is insulin dependent diabetes. Those patients with type 1 diabetes, they cannot produce insulin, and that is why insulin has to be given from outside as an injection. Whereas the second category, that is type 2 diabetes, traditionally these patients are treated with the oral anti-diabetic drugs, and when oral anti-diabetic drugs, either they produce insufficient response or the blood glucose level is too high, these patients, even though they have type 2 diabetes, they also might need insulin injections. So let us discuss what are the different types of insulin preparations we have. Additionally, some patients who have type 2 diabetes, especially in pregnancy, in maybe those patients who are undergoing surgery, those patients who have high stress, they also need insulin. So let us discuss the insulin preparations. Now, insulin preparations, broadly, the first category of insulin preparation, you can say these are called as the rapid acting analogs. Rapid acting analogs of insulin. Second, short acting insulin. Third, intermediate acting insulin. Fourth, long acting insulin analogs. And the last one is insulin mixtures. So this is one way of classifying the preparations of insulin. So let us discuss each one of them. As the name suggests, these are rapid acting insulin analogs. That means they are rapid acting, but they are also short acting. They are insulin analogs. That means some modifications have been done in the amino acids of the insulin, and that results in the formation or production of the rapid acting analogs. The examples of rapid acting insulin analogs, remember, insulin Lispro, insulin aspart, insulin glulicin. So remember the acronym LAG. Insulin Lispro, insulin aspart, insulin glulicin. These are the rapid acting insulin analogs. Again, just to revise, insulin Lispro, insulin aspart, insulin glulicin. If you remember the acronym LAG, these are the rapidly acting but short acting insulin analogs. Short acting insulin is the regular insulin. So regular insulin, plain insulin is an example of short acting insulin. This is the only insulin which is useful for giving IV, intravenous injection. Regular insulin can be given. Intermediate acting insulin example is neutral protamine hexagon. So NPH, neutral protamine hexagon, is an intermediate acting insulin. The next category is long acting insulin analogs. The example is insulin glargine, insulin detimir, and insulin degludec. These are the examples of long acting insulin analog. And then we have the insulin mixtures, which is a combination of short acting insulin and long acting insulin. So this is the classification of insulin based on their duration of action, and this is based on the analogs or the insulin. Again, I will just revise this. So 5 different categories of preparations of insulin. Rapid acting insulin analogs. Example include insulin lispro, insulin aspart, insulin glulicin. Short acting insulins, example is regular insulin. These insulins which are rapid acting, they are given as subcutaneous injection, whereas the regular insulin can be given even IV in addition to subcutaneous injection. Intermediate acting insulin, example is neutral protamine hexagon. Long acting insulin analogs include insulin glargine, insulin detimir, insulin degludec. So if there is a question on insulin analogs, these are the 2 categories: rapid acting insulin analogs and long acting insulin analogs. What is the benefit of insulin analogs? The benefit is that their pharmacokinetic is favorable, and that's why blood glucose level is controlled better with the insulin analogs. Depending upon the duration of action, if you need a rapid action, they can be rapid acting analogs, they can be used. Long duration if you want, then long acting insulin analogs can be prepared. So this is can be used. So this is one of the ways of classifying insulin preparations. Second way of classifying insulin preparation is, you had initially there were conventional insulin preparations, porcine and the bovine insulin preparations, then highly purified insulin preparations. So highly purified insulin injections, then there are human insulins like NPH and the regular insulin or plain insulin. Then there are insulin analogs. So in the insulin analogs, we talked about the rapid acting analogs of insulin and the long acting analogs of insulin. There are other preparations which are, or there is other way of classifying insulin, like the semi-lenti insulin, lenti insulin, and ultra-lenti insulin. Semi-lenti, these are short acting, lenti are intermediate acting, and ultra-lenti are long acting. So these are different ways of classifying insulin preparation. The most common is the use of either rapid acting insulin analogs, short acting insulins, intermediate acting insulins, and long acting insulins. So this is based on the manufacturing process, this is based on the duration of action. Again, based on the duration of action, this is another way of classifying insulins. So thank you.